In this new report, the Disability Law Center of Virginia is asking the state to strengthen regulations and to impose more serious sanctions to try to decrease preventable deaths in vulnerable adults. New data compiled by the Disability Law Center of Virginia reveals alarming trends in sudden and unexpected deaths in Virginians with intellectual and developmental disabilities who receive services licensed by the state.
I believe the majority of them were preventable, that at a minimum, that their odds of survival could have been improved.
Colleen Miller, who heads up the DLCV, says her office has access to incident reports from facilities licensed by the Virginia Department of Behavioral Health and Developmental Services. And after reviewing 3 years' worth of reports of unexpected deaths, her office found in nearly half of reviewed cases, staff delayed or failed to perform CPR or call 911.
We found an alarming percentage of deaths that seemed to be related to poor staff response to the incident. Either a failure to call 911, calling their supervisor first to find out if they should call 911, sometimes leaving the premises before calling 911.
Some providers repeatedly violated the same safety regulations without facing meaningful sanctions.
We saw situations where the staff of the provider failed to follow the feeding protocols repeated times and had no serious sanctions against them for that.
And a failure of supervision led to preventable choking deaths.
There were a number of deaths that were related to choking for people who had special protocols to prevent them from choking on their foods.
Miller says on death certificates, the person's death was often attributed to their disability or mental illness, which are not fatal conditions.
There was a very high number of these were attributed to things like cerebral palsy or mental retardation was the phrase that was used in some of them. And those are not terminal conditions. Those are not fatal conditions.
To try to save lives, Miller is now asking the state to require regular medical emergency drills in all licensed programs and to enforce stronger penalties for providers whose neglect endangers lives.
And it's not really until you accumulate them and look at them as a pattern that really strikes you how horrible this is, how awful this is, and how preventable it is. How, with the patterns of the things that we identified, many of them are deaths that did not need to happen.
I'm Melissa Hippolyte for CBS 6.